Okay, good morning, ladies and gentlemen. Thank you very much for being here with us today. My name is Andreas Stratis. I'm application specialist in molecular imaging and computed tomography. And with my colleague Jakub Siennisci, our PET clinical leader in the region, we're going to present to you today one of the latest advances in PET-CT imaging, our deviceless and fully digital solution for respiratory motion correction, the so-called motion-free. I will start the presentation with some technical details about motion-free, about the workflow, and then I will give the stage to my colleague to present to you some clinical cases. So some words like a short introduction about respiratory motion correction. So respiratory motion and the related artifacts which are incurred in clinical images are very well studied in literature. Respiratory motion is an inherent drawback of PET-CT imaging because, as you know, breath holding is not an option due to extended scan times. Almost 50% of PET scans have been reported to suffer from respiratory motion artifacts, not limited only to the thoracic region, but also to the abdomen and also to the pelvic region. Moving region of activity is producing blurred and fainter images, which are associated with inaccurate localization of the features of interest. However, and this is very interesting, is that only 5% of PET-CT scans are applied today correction techniques, which means that this technique is actually not a standardized one in a clinical setting. So let's see together, let me activate the laser pointer. Let's see together now how non-corrected images may influence diagnosis. Here on the left, you can see a patient who has been scanned without any motion correction technique applied, while on the right, it's the same patient with a motion-free correction algorithm applied. So you can see how much more clear the borders of the lesions are displayed in the corrected image with sharp margins and without any localization artifacts, without localization actually being affected by blur due to motion. Quantitation accuracy has also been reported to be better. Here you can see that as it is stated in literature, there is up to 30% improvement in quantitative accuracy in SUV mean calculations, and also there is an up to 67% improvement in volumetric accuracy of lesion size. So what are our weapons against the respiratory motion artifacts? First of all, our first option is the so-called Q-static with the use of an external camera. The patient is like on the bed, as you can see in the video, and the camera, which is positioned next to the patient, is actually tracking the movement of a reflecting box, which is positioned on the region which is mostly affected by the respiration. So the reflecting box is applied actually on the thoracic region and also on the abdomen region. So in regions where activity is accumulated, annihilation photons are produced and detected by the scanner. The respiration cycle is synchronized with the scanner, and only those photons that are detected during the less moving phase of the respiration are taken into account and form the images. So here you can see actually how the Q-static image is built, and on the left there is the image without any motion correction technique applied, so the lesion is very blurred. We have the motion view, the 4D video, let's say, of the lesion and the Q-static corrected image. So do we have another option? Yes, we have the Q-freeze option, which resembles the Q-static in the sense that it's also using an external camera, which is also tracking the respiration with the use of a reflective box. But in Q-freeze, the system is splitting the respiration cycle in phases and uses all photons detected throughout the respiration cycle. So not only during the twisting phase. Then it is performing the phase matching, a procedure where images captured at the same time are combined together at the same phase, are combined together to provide one image per phase. So what is next? What is the digital solution that brings respiratory motion correction to the next level? This is our seamless, fully digital solution without any need of external device, the so-called motion-free. So what are the advantages, the main advantages of the motion-free? First of all, it is always on and seamless. There is no need for any external device. There is no time waste in manually preparing the patient and the camera itself. In motion correction techniques with the use of an external device, there is a procedure that has to be followed before the scan starts. There is a procedure where the technologist has to initiate the camera and synchronize it with the protocol. This is sometimes complex. This is a complex procedure, and maybe this is one of the reasons that motion correction as a technique is far from being frequently applied today. This is simply irrelevant with motion-free, with our deviceless solution, because there is no any external device at all. So there is no time waste at all. A third advantage is that with motion-free, we also get rid of patient discomfort. When external camera is used, then patients need to be instructed initially to breathe normally. They feel the pressure of having a box on their body. Some small details that make an already stressed patient feel even more stressed. So apart from all this, motion-free is a real-time, fully embedded and integrated solution in routine protocols. The system digitally identifies the regions which are mostly affected by respiration and autocorrects when necessary, without making any guesses. So the technologist does not have to select beforehand the regions that have to be corrected. The system does it automatically in a fully integrated procedure. So apart from all this, do we have any other advantage? Of course we do. Let me take some seconds to share with you this video here. So here you can see the same patient who is scanned on the left with an external device and on the right with our deviceless motion-free solution. So as you will realize, there is a big difference in the total scan time, which is very, very important, especially in case of a very busy department. So as you will see, in total, the total scan time with motion-free for this patient is reduced by almost 5 minutes, 4 minutes and 37 seconds, which is extremely important when it comes to a very, very busy department. So this is another advantage. And finally, we have something else. While external device gating may fail for several reasons, like this one here, reasons like unstable respiration, short breathing cycles, no proper positioning of the reflecting box, or miscalibration of the camera, motion-free, on the other hand, guarantees a perfect motion-corrected acquisition that can save time and reduce patient discomfort. So let's see now how actually this algorithm, this motion-free deviceless solution is working. Motion-free is an algorithm which is based on a concept which is called principal component analysis. I will hereafter call it PCA. PCA is actually a dimensionality reduction method that is often used to reduce the dimensionality of large data sets. Like pretty much like here, you have an image, and it is decomposed to the RGB red, green, and blue components. In a 4D PET image, let me activate again the laser point. In a 4D PET image, of course, we don't have RGB components. We have location components, and we have also the time components. So respiratory motion, in essence, this is what I want you to remember. Respiratory motion is nothing more than a repeated movement of location data over time. This movement of data is the respiratory component of the PCA, and that the PCA aims to detect, to spot and detach from a motion affected image. By identifying the principal components, we are in the position to assess and estimate the input and the impact of the respiration in the image. So here, this P1 and P2 actually are the respiratory waveforms, 1D respiratory waveforms that impact the image. So the PCA, it tends to detect these 1D respiratory waveforms directly from the data and correct for them. So how is it performed? In the first step, we acquire PET coincidence events. These coincidence events are producing sinograms every half a second, every 500 milliseconds. In such a way, we organize the data over time. This looks like we have data in a list mode, and we reorder the data in 0.5 second sinograms. In a second step, the PCA, the principal component analysis, is applied, and we aim with this PCA to generate the 1D respiratory signals as a function of time. These are actually, as we said, these signals represent the variation of data in space. This is nothing more than variation of data in space. So this P1 and P2, these represent here the respiration signals. In a third step, we apply the mathematical process of the Fourier transform. With the Fourier transform, we aim to convert these P1, P2 signals to move it to the frequency domain. We can calculate the motion frequency rates and taking into account that we have to remember here that the respiration normally is 2.5 to 10 seconds, which means that it is about, they have a frequency of 0.1 to 0.4 hertz. So if we identify a frequency in that signal, which is in the range of 0.1 to 0.4, this means that this corresponds to respiration, and we have to correct for it. So apart from detecting if this is due to respiration or not, we can also see the magnitude of the respiration, and if we can identify if it is worth to correct for it or not. So a value which this is by calculating this R here, this R ratio, which is actually providing the impact, the strength of the respiration to the image itself. So when this R value is beyond a certain threshold, then this means, and of course it is between 0.1 and 0.4 hertz. This means that this is due to respiration, and the respiration has a large impact on the image. And of course, then the algorithm understands that it has to correct, and it does it in a fully automated way. So now let's see a little bit how it's working in real time. So in the actual workflow, nothing really changes. Motion free is fully integrated in the protocol. There is no any real change in the procedure. Physiological motion is detected automatically, and the image is corrected. Nothing changes. Of course, motion free can be enabled for every bed. If there is no motion, the system, of course, will not apply any motion correction. If there is a detected motion, then the system will automatically do it in a very easy and reliable way. As we can see here, so the stance starts from the head. There is no any detection of motion in head. It goes towards the thorax. It sees that it detects some respiration there. It corrects automatically, and then it's going to the abdomen. Again, there is some motion correction, and then as it moves towards the pelvis and the extremities, there is no motion correction at all because there is no any movement. And finally, this is my last slide for me. It's like moving smoothly to clinical cases and give my stage to my colleague. I'm presenting you a case here of a patient without any respiratory motion correction algorithm applied here. This is conventional static acquisition. And we have in the middle the motion free applied with 1 minute more time in case where in the bed where the motion has been detected. And on the extreme right image, we have motion free with 2.5 minutes extra time where motion is detected. And we can see here that in this case, we have a total saving in time of 4.5 minutes in the middle case and 2.5 minutes in the case on the right, compare of course to the use of motion correction with an external device, because motion correction would have been applied with an external device in 2 beds and not in 1 like we did it here. And the second conclusion is that actually the image quality in the case of the 2 motion-free images is not very different. It's actually comparable, which means that the extra time which is applied per bed with motion-free it does not significantly impact the image quality. So this is for me, and now I'm giving the stage to our PET clinical leader, Mr. Siennisci, to present you clinical cases. Thank you very much for me.
Thank you very much, Andreas, for this great presentation. That was really comprehensive technical approach about motion free. So our latest motion correction technique, but we are able to apply it in PET-CT scanners coming from GE. As we were talking about motion free, first thing that we are thinking and first areas that we are thinking that are influenced by respiratory motion are, of course, lung areas, especially lower part of lungs and upper liver. But this image is demonstrating very nicely that it's not the case of these 2 areas only. Please have a look on the abdomen area, how all intestines and lower abdomen areas are moving as well. So here we could confirm that respiratory motion is affecting entire abdominal and chest area and not only the middle part. And that is quite important in terms of using motion free. As Andreas mentioned, a system by itself is detecting motion. So if the motion is appearing in abdomen area, of course, that correction will be applied. So that is quite good for us, as we don't need to take care and we don't need to plan in advance where system will look for a motion. And that is a very important thing in relation to previous techniques as well. So here, thanks to this one, thanks to features allowing to use it for entire body, we are able to solve respiratory blurring issues in entire body. Next, Next slide is appearing and is demonstrating several evidences related to using respiratory gating and techniques. These results are coming from different researchers using motion-free and previous version of motion-free with external camera. What was already proved with many studies is that respiratory gating techniques are improving lesion detections. And that is extremely important, as thanks to that, sensitivity of PET scanning is increasing even more than 30%. So that is extremely important. But thanks to using this technique, we are able to define more small lesions. Extremely important fact is also improvement in terms of quantification. As we know, when blurring appears in the image, accuracy of quantitation is extremely low because uptake is spread into different volume of interest into different voxels. And thanks to using motion free, this effect is limited, and that is very significant improvement in terms of quantification as well, around 33%. Very important effect is also related, for example, to liver lesions detection when in regular scanning, especially in the liver, a lot of lesions are reported as equivocal. And thanks to motion-free, 95% fewer equivocal lesions are appearing in reports. So that is significant as well. Related to above is also improvement in staging, as that is changing accuracy up to 20%. In relation to better quantitation, better lesion edges definition, and more accurate volume definition, there is improvement in radiotherapy planning, reported as well in publications. Here, I would like to move right now to clinical images where we are able to see examples where during regular scanning in PET-CT, motion-free was not applied here on left-hand side, and on the right-hand side, we could see motion-free. So here on the conventional image, there is, of course, a question where the lesion is localized. Is it in lower lung or in upper liver? And on right-hand side image, of course, that is clearly seen. That location is very well defined, and here we could see on actual fused image how accurate it is and how well the lesion is seen. Additionally, here on this example, we could see improvement in terms of SUV max quantification from 5 to 6.74. So huge improvement. And the same huge improvement for volume accuracy, as because of blurring, lesions, especially small one, looks far much bigger than they are in reality. And here with motion free, there is a decrease in volume, and that is predicted effect that we are expecting. By the way, that is extremely nice example, as acquisition was done after injection of only 88 megabecquerels of FDG. So that is really low dose scanning with very good quality. That is already seen on conventional static and improved with motion free, with all aspects of motion free. Here, another example, also with very, very low dose, almost 19 megabecquerels of FDG injected, and patient with 20 BMI. And here is example where lesion was not detected on conventional static image. And here a liver could be really reported as a regular neutral one. And with motion-free, additional lesion was detected. So here, of course, accuracy of clinical findings is far much improved, and patient pathway could be changed. This example is demonstrating patient also with improvements in detectability. But here, extremely important are changes in terms of quantification. SUV max for first lesion is changing from 4.62 to 6.44, and volume is decreasing as well. The next one is changing from 5.5 to 8.6. And here we could definitely see that lesions are better seen, and their conspicuity is higher. And overall image quality in terms of contrast, in terms of noise, is also improved on these motion-free images. Quite interesting example is demonstrated here. Also very low dose injection, 90 megabecquerels, where lesion is localized close to spine. And here on this MIP, we could see that it's quite difficult area close to kidney uptake. And here someone could think, okay, where is it localized? Is it really lesion? Is it what's happening here? And here, normally we are not expecting a respiratory motion. Close to spine, abdominal area, close to kidney. Intuitively, that's not the area where we are expecting motion. But motion-free reveals that this area was affected by respiratory motion, and there is a huge improvement in terms of detection of this lesion thanks to this technique. Far much better seen both on axials and MIP images. Another example is related to gallium studies, gallium dotatate, where these images are really comparing night to day, especially in liver part, as there are many lesions seen here on conventional image, but with motion-free, we could see them more clearly, and also new lesions are appearing. And that is also seen on actual slices. Here is just one demonstration. SUV max is changing from 11.25 to 14.05, and really lesion is far much better seen. And so here, I believe it's worth mentioning that thanks to motion-free, it's far much easier to report PET-CT scans. You don't need to spend too much time to think about lesion localizations, lesion conspicuity. Is it noise? Is it lesion? Everything is far more clear thanks to motion-free. Another example related to gallium dotatate is also here demonstrated on this slide, where especially lesions in the upper part of the liver are far much better seen, and that is also perfect confirmation of excellent resolution improvements thanks to motion-free. So here on the left-hand side, this especially one of these lesions is almost not seen, and here improvement in terms of signal to noise ratio is so huge that we are able to define these lesions, and what is important, they are also seen as a separate one. And if this area is area where we are expecting, of course, motion related to respiration. So normally in this conventional static image, we could think, okay, is it one lesion? Are there more? What is really happening? We are not confident with this image. And here we could really confirm how many lesions are seen, and we are confident in terms of quantitative accuracy. A very interesting case is demonstrated here with this study, as a conventional static image is not demonstrating any lesion, and a new lesion is appearing on the right-hand side lesion. Even more interesting case is this F-DOPA acquisition, on which patient was referred for this study because of higher hypertension. That was the reason of that was not defined. Several years ago, a patient was having post-adrenalectomy on the right-hand side, on the left-hand side, and right now there was a lesion seen in the MR, but doctors were not able to define, is it related to pheochromocytoma or not? And patient was referred for this F-DOPA, and patient was extremely lucky, to be honest. That was the first week of using motion-free in Europe, and there were double reporting. So first, that means that firstly, patient was reported by a resident. Later, images were checked and were checked also with motion-free by advanced doctor. So first report was done without motion-free, and that was reported as regular adrenal uptake. During second reading, motion-free was used additionally, and this lesion appears very, very clearly. So thanks to this one, patient was referred for histopathology that has confirmed pheochromocytoma of approximate size of 4 millimeters. So extremely important finding for this patient that has changed patient diagnosis. So we have also very, very important impact on patients reported. Here, as we could expect, but of course respiratory motion is not affecting only regular size patients, but also high BMI patients. And here we could see that we are able to get very good image quality of such image, but even with half time extension of motion free, we are able to define lesions far much more clear. There are already evidences reported in publications, but are treated as a retrospective scans, and they are confirming when with retrospective scans time extension is impossible, and they are also confirming that motion free was improving image quality and improving clinical evidences. Especially interesting is a scientific report published in Nature about accessory spleens, where that was noted that there was a group of patients that was able to not be, that was having possibility of not having biopsy, and biopsy was excluded because of using motion-free, and what was very important impact of clinical pathway. And now, last example that I would like to demonstrate is related to combination of all techniques that we are able to have on our scanners. Firstly, I would like to emphasize the fact that motion-free is a technique that is available on all GE platforms of PET-CT. So that is available on Discovery IQ, Discovery MI, Digital Ready, and Discovery MI. And here, that is demonstration of all techniques that are nowadays used routinely in most of our systems. So normally we are able to do and to use high sensitive systems and get very good image quality. Here, combining iterative reconstruction with time of flight and sharp IR. Additionally, in GE, we are able to use BSREM algorithm that is unique for GE. In GE, we are calling it Q-Clear, and that is improving signal to noise ratio. Additionally, we are able to use motion-free, and here is a demonstration of impact of reduced blurring and improved contrast thanks to motion-free. And the last one that is unique for GE totally is combination of motion-free, deviceless respiratory gating, and BSREM reconstruction that is improving relation of noise to signal and improving convergence of SUV quantification. Here, I would like to thank you very much for your attention. What was pleasure to have possibility to demonstrate you clinical evidences related to motion free. Thank you very much.
Thank you very much, Jakub. Thank you very much for being with us today.